Hi guys! Welcome back to my channel. Andito na naman tayo at nagpapasabog ng good vibes. This is indaychangge, your nursing charge. So hi guys, how are you? As I've mentioned on my last vlog, I'm going to help you on the strategies on taking examinations. So here are the 10 tips on how to pass your nursing exam. Either you are a nursing student or a nurse who will take NCLEX examination, IKAW examination, whatever kind of exam in nursing. But we're going to start after the intro. Yes, I've mentioned in my last vlog that I'm going to help you on how to pass nursing examinations. So here are the tips on how to pass nursing examinations without hassle, easy, and with manageable time. Were there sometimes na kinakabahan ka kasi midterms is coming and nagka-cram ka because you don't know those things na tinatapos? And moreover, online class lagi ang ginagawa ni clinical instructor. I guess you don't need to worry because here are the 10 strategies on how to pass your examinations. But first, please don't forget to click like, comment, and subscribe to my channel. Also, hit the notification bell so that you're going to be updated on whatever upload that I'm going to take. I understand that you gave already your mind, body, and soul in nursing. Tapos, biglang in-click, natatakot ka dahil lang sa exam, diba? And for nursing students, I guess, they are facing troubles right now, especially it's online class. Walang magawa ang mga students. Of course, if I am the student, hindi ko rin alam yung mga nangyayari at bedside. Tapos, ang ibibigay sa akin ni clinical instructor na scenario is all about bedside. So, how am I going to answer these questions, ma'am, kung hindi ko naman alam ang nangyayari at bedside, diba? Online class is not enough. So, as a help to our nursing students and also to the nurses who are struggling to review because they want to go to the other country or they want to excel in nursing, here is the right video. At bago ka pa mag-panic at sabihin sa sarili mo na mag-back out, don't panic. You have the knowledge. You all have the knowledge. I repeat, you all have the knowledge. But you just need to know how to leverage it. So, let's start. Number 1 on my list is always focus on your patient. Remember, nursing examination or the nursing field only talks about patient safety and patient needs. That's why there is patient-centered care, right? So for example, merong situation yung patient mo or she or he has been diagnosed of asthma. Of course, asthma, ang dami-daming symptoms nun, right? So if you're going to check it on that specific question na may nakasabing asthma, think about those symptoms na nandun sa mismong scenario na yon. And then check on the choices already that is specific to that symptoms. Remember, every patient is different. Hindi lahat ng patient ay pare-pareho ng situation. Hindi pare-parehas ang pag-treat ng disease nila. That's why in medical field, always have this patient-centered care because the care is depending on the needs of the patient. So always remember, focus on your patient. Also, in choosing your answer, always think about the feelings of the patient. Take into account their preference or over them choices when possible. Number 2 on the list is pick the umbrella answer. Kapag may nakita ka, for example, na pare-parehas ng sinasabi, specific to your question, hanapin mo kung sino sa kanila ang umbrella or sino sa kanila ang nagpapahiwatig na cover lahat niya yung mga choices. Do you remember your nursing instructor na nagsasabi sa'yo na, well, it is correct, but it is not the most correct. So meaning to say, we are referring to the umbrella answer of your choices. So, whenever you see something different from the choices, always pick the umbrella answer. Next on the list is watch for global words. Global words or the absolute words like always, never, every, must. I guess those are the absolute words that we need to avoid whenever we choose our correct answers because anything that implies you must do something without any exception is typically incorrect. The next is live in an ideal world. Yes, we understand that we have limited resources in the hospital. Meron tayong understaffing, meron tayong problems sa resources. Some of the medical professionals are not really helping and there is problem among your team. But think about this one. You are in an examination. So whatever things na nangyayari at bedside, live it. Get that book. Whatever that book is telling you, apply it. So during the examination, you must apply whatever is ideal. Forget about those things that is being happened at bedside because it will not help you during your examination. Think about those moments that your clinical instructor is telling something that is ideal. Always know your priorities and apply ABCSDEF. That stands for airway, breathing, circulation, safety, discomfort, education, and feelings. Always remember that mnemonics. Whenever you are already picking some choices or you are trapped in two choices, especially airway and breathing, remember, airway, this is the scenario wherein the oxygen is going to the lungs. Okay? So the air will enter to the lungs and B is the gas exchange in the lungs already. So, if you are going to choose between A or B, airway or breathing, always remember airway comes first before breathing. And once you are done already with A, B, C, do not forget patient safety. Every board of nursing prioritizes patient safety. So, if you are already seeing in the choices that A, B, C is not around, go to the choice that prioritizing patient safety. And if safety is not there also, then speak to the pain. How is the pain level of the patient? Does the patient having any discomfort? And if so, get that answer. What if you are not seeing ABC and safety at the choices? So let's proceed. That is the education. Part of the nursing job to educate our patients, especially on their medications, safety, fall risk activities, and others. It is our job to educate our patients, especially in promoting patient safety and welfare. The next one is, what if I cannot see airway, breathing, circulation, safety, discomfort, and pain at the choices? Okay, so let's proceed to the last one, that is the feelings. So whenever we are talking about therapeutic communication, let's always pick or choose the word, tell me more. What are those things that you want to tell me? Tell me more about it. Tell me your feelings right now. Those are the things that you need to choose. The feelings of the patient. Always prioritize the feelings of the patient. Therapeutic communication is already a wide topic, but what I am saying here is that remember to consider the feelings of the patient, and that is our priority. The next one is always know or remember your nursing process. So let's start first with the assessment, diagnosis, planning, intervention, and evaluation. If you are already seeing in the choices that says about assessment, and in the question, patient is still not being assessed, so why not apply the nursing process? If the question is telling you something that the patient is not yet assessed, go directly to assessment. But if the question is already telling that the patient is being assessed, there are symptoms that already presented, there are already a specific assessment that is already being shown in the picture, so proceed already to the diagnosis. And if there is already a nursing diagnosis in that specific scenario, proceed to the planning. Is there a plan for that patient? Okay, so if you are already seeing also an assessment, diagnosis, planning in that specific scenario, proceed to your interventions. And in interventions, always remember to choose the independent nursing interventions before the dependent interventions. Then evaluate your actions. Do not proceed into intervention without even assessing. Always remember that we have a nursing process in the nursing field, and that is one of our foundations. Whether you are actually taking the exam or just receiving a patient, always remember nursing process. It's a vital part of the nursing world. Also, know your medications. In the field of nursing, nurses are not just giving medications, or they are not just preparing those drugs that are being ordered, but in nursing, there is critical thinking. Remember that whenever you are giving medications to your patients, always think about those indications, contraindications, side effects, and adverse effects of that drug, so that you know when to call your doctor. You know those things that are just normal. You know what to answer to your patient whenever they will ask something. And do not forget also, whenever you are administering medications, always ask for the patient's allergy. For example, You don't know that specific drug that is being mentioned in that question. What is that possible solution that you can take? Go back to your question. Check about that diagnosis of the patient. Sometimes the nursing questions specifies the diagnosis of the patient. So go back to the question, check the diagnosis, and always think about your prefixes and suffixes like metoprolol, lol, like that, right? The next one is don't pass the buck. Remember what I mentioned earlier? Always do your independent nursing interventions first before going to the dependent nursing intervention. And on this part, put at the last part those choices that is telling you to call for the physician. You need to do something first before leaving your patient. So for example, in the choices, it mentioned there to call the provider. Of course, you should not do that yet without doing any interventions, right? So do an intervention that is specific to your scope of service before calling your provider or your physician. Don't pass the buck choices are sometimes crop in nursing examination. So the test is actually assessing you on what you are going to do, not on what you are going to delegate. And on this area, always remember your scope of service. What are the scope of service of nursing that I can, for example, I can give to my patient before I will call my doctor? Calling the doctor might be the best option down the road, but you must do nursing interventions first or independent nursing interventions first before calling your provider. The next on the list is know your laboratories. Memorization might not be for you and it might not be for me too, but let's consider patient laboratory results. If you know the normal range of this kind of laboratory, at least you would know when to call help. For example, your patient has already a potassium of 6.5. That is already life-threatening to the side of the patient, and you saw it in the laboratory result, right? So that is the time already that you need to inform your provider so that your provider needs to plan for the specific treatment also of your patient. For example, also, you are giving a medications, administering medications. Of course, you should know also the laboratory results of your patient so that you would know when to stop to administer the medication or when to hold the medication. Most of the time, memorization is not really for nurses, but laboratory result is an exception. And of course, the last one, whenever you are taking the examination, always pray, meditate, ask for help from the Almighty. So those are already the 10 strategies on how to pass nursing examinations. This vlog can be for nursing students. They can apply it already in their midterm examination, final examination, or whatever kind of examination they are facing. And this is for nurses who wants to upgrade their licenses in nursing. So guys, if you like this video, please don't forget to click like, comment, and subscribe, and hit that notification bell down below. And I guess there's nothing more that I can add. Thank you so much guys for watching. I hope you enjoyed the video and I hope it will help in your nursing examinations. By the way, if you need some reviewers in nursing, please don't hesitate to message me, contact me so that I can send you some help. I can send you soft copies that can help you in your nursing review. So I guess there's nothing more that I can add. Thank you so much for watching. This is Indaychangge, your nurse in charge. See you again in my next video. Bye!